Hello everyone, I am Dr. Shankar Dey, and today in this session we will discuss about a very important surgery short note for final year MBBS students, that is ranula. So first of all you have to know what is ranula. So ranula is a type of extravasation cyst that arises from sublingual gland or mucous gland of none or glands of Blandin in the floor of mouth. So what is ranula? So what is ranula? Ranula is a extravasation cyst. So ranula is a extravasation cyst, extravasation cyst that arising from sublingual gland. So either sublingual gland or mucus gland or mucus glands in the floor of mouth. Mucus gland in the floor of mouth. Either glands of none or glands of Blandin. So what is ranula? Ranula is extravasation cyst. So ranula is extravasation cyst that arising from either sublingual gland or mucus gland in the floor of mouth, either gland of none or gland of Blandin. So this is ranula. Next point is why it is named as ranula. Why it is named as ranula. So the name is derived from the word rana. The name is derived from the word rana. Rana means frog. Rana means frog. The scientific name of frog is Rana trigrina. As ranula looks like belly of frog, that is why it is named as ranula. Why it is named as ranula? Because ranula looks like belly of frog. Ranula looks like belly of frog. Hence the name ranula. So now I will show you the image of ranula. See, this is the image of ranula. This is the image of ranula. Here you can see presence of one swelling in the floor of mouth, that is actually ranula, that is extravasation cyst arising from sublingual or mucous glands of none or glands of Blandin in the floor of the mouth. Occasionally it can occur in submandibular salivary gland also. Now what is the pathogenesis? Now what is the pathogenesis behind development of this swelling? So now we will learn the pathogenesis of this swelling, how this swelling is formed. First of all, there is blockage of duct of the glands. For some, first of all, there is blockage of duct of the glands. Which glands? Either sublingual glands or mucus gland in the floor of mouth, like gland of none or Blandin. Then, because of the blockage of the gland, there is formation of retention cyst. There is retention cyst formation, and because of further accumulation, there is increased pressure inside the cyst. Increased pressure. There is increased pressure inside the cyst, and this is followed by rupture of the acini. This is followed by rupture of acini, and finally the contents of the acini extravasates to form extravasation cyst, to form extravasation cyst. So what is the pathogenesis? Suppose this is a duct and this is the gland. First of all, there is some pathology in the duct and there is blockage of the duct. Because of the blockage, there is accumulation of secretion inside the gland or acini, that is retention cyst. With further accumulation, the size of the gland increases, size of the gland, and this is followed by rupture of the acini, and this rupture of the acini is followed by extravasation of contents of the acini that produces one extravasation cyst, that is actually ranula. So ranula is nothing but extravasation cyst arising from either sublingual gland or mucous gland in the floor of mouth, sometimes from submandibular salivary gland also. Now, what are the clinical features? Before discussing the clinical features, let's discuss some points about the pathological features of ranula. It is lined by columnar epithelium. So ranula is lined by either columnar or cuboidal epithelium. So either columnar or cuboidal epithelium, columnar or cuboidal epithelium, which in turn covered by delicate capsule. So ranula is lined by columnar and cuboidal epithelium, and on the outer surface of the epithelium there is delicate capsule of fibrous tissue, delicate capsule of fibrous tissue. And what is the content of this extravasation cyst? It content it con its contents is actually clear, ropey or jelly like fluid, clear, ropey or jelly like fluid. So it contains clear, ropey or jelly like fluid. Now we will discuss types of ranula. Now we will discuss types of ranula. What are the types of ranula? Ranula is divided into two types. One is called simple ranula and another is called plunging ranula. So one is simple ranula and another is called plunging ranula or cervical ranula or cervical ranula. What is simple ranula? I have shown you the image. Actually, this is simple ranula. Actually, this is simple ranula. When ranula is situated only in the floor of mouth, this swelling is situated only in the floor of mouth, just lateral to the frenulum. This is actually frenulum. This is frenulum, and this swelling is situated on the floor of mouth just below the tongue on the side of the frenulum. So when the swelling is situated only in the floor of mouth, then it is called simple ranula. So simple ranula is situated only in the floor of mouth. But when it is called plunging ranula, when intrabuccal ranula having a cervical prolongation, when intrabuccal ranula having a cervical prolongation, then it is called plunging ranula. Then it is called plunging ranula. See here, you can see there is cervical prolongation. See, so the in so the intrabuccal ranula. So the intrabuccal ranula is prolonging in the cervical region. So this is plunging ranula. So what is plunging ranula? Plunging ranula is when intrabuccal ranula or intraoral ranula having a cervical prolongation, having a cervical prolongation, that is called cervical ranula or plunging ranula. Actually, this comes down along the posterior border of the mylohyoid. So here lies one muscle on the floor of the mouth, that is mylohyoid muscle, at, and this swelling comes along the posterior border of the mylohyoid and appears in this region. In this region, see, this is actually submandibular region. So two swelling in case of plunging ranula, one is intraoral and another is cervical. This is called plunging ranula. Plunging ranula is actually dumbbell shaped. Plunging ranula is dumbbell shaped. So plunging ranula is dumbbell shaped, two swelling connected together like this, one intraoral and one, and another is cervical, just along the posterior border of mylohyoid. Suppose this is mylohyoid, this is posterior border. So one is oral lesion and another is cervical lesion. Now we will discuss the clinical features of ranula. So now we will discuss the clinical features. So clinical features of ranula. Clinical features: ranula occurs in younger age group and both sexes equally. So ranula occurs mainly in younger age group. So ranula occurs mainly in younger age group, either younger adults or children. So more commonly ranula occurs in children and younger adults. It is found in male and female equally. So it is found in both sexes equally, both male and female. And what are the characteristic features of the swelling? So what are the characteristic features of the swelling? First of all, site. So what is the site? In case of simple, it in case of simple ranula, it is on the floor of mouth. So it is on the floor of mouth, just below the tongue, just below the tongue, and on the side of frenulum, below the tongue, on the side of frenulum. I have shown you the image. So that is about simple frenulum. But in case of plunging ranula, along with this side, another extension is there in the cervical region. In the cervical region, in case of plunging ranula. Now, size of the ranula, size is actually variable. It may be very small, it may be large. It is usually 1 to 6 centimeter in diameter. Then surface, after site and site, surface, usually surface of the ranula is smooth. So surface of the ranula smooth. Color of the ranula, color is slightly bluish. So color is bluish. Then laterality, it is unilateral. Laterality, the swelling is unilateral. Then tenderness, there is no tenderness on palpation. So tenderness absent. Then consistency. Then consistency is either soft or firm. Soft or firm. Then transillumination test. Transillumination, this swelling is brilliantly transilluminant. This swelling is brilliantly transilluminant. So brilliantly transilluminant. Then fluctuation test. Then after transillumination test, fluctuation test. So the fluctuation test is positive. That means the swelling is fluctuant, and in case of plunging ranula, the cross fluctuation test is also positive. That means plunging ranula is cross fluctuant. Then that means whenever we press or whenever pressure is applied over one swelling, that causes increased pressure on the another swelling. Suppose if you give pressure on the cervical swelling, the oral swelling will be enlarged, and vice versa. If you press on oral swelling, the cervical swelling pressure will be increased. So this is called cross fluctuation. Now I will show you the image of trans illumination test. So see, this is actually image of trans illumination test. Trans illumination test. So see the swelling. The swelling is brilliantly transilluminant. The swelling is brilliantly transilluminant. This is ranula or plunging ranula. So now about the investigation. What are the investigation that is needed to diagnose? So what are the investigation that you will perform to know the details about the swelling? One investigation is USG neck. So first investigation is USG neck, and the second investigation is MRI neck and oral cavity. MRI neck and oral cavity. MRI neck and oral cavity. So this is about the investigation. And digital palpation. Digital palpation is done to diagnose the swelling clinically. In case of plunging granula, it is bi-digitally palpable. Bi-digitally palpable. By digital palpation, you can assess side, surface, tenderness, temperature, consistency, and another thing that you will perform is test, trans illumination test, fluctuation test, etc. Next thing is, what are the differential diagnosis of this swelling at this site of oral cavity? One is sublingual dermoid. So sublingual dermoid is another swelling that can be found in exactly same place, just below the tongue on the side of the frenula. Another is lymph cyst. So these are the differential diagnosis of the ranula. Lastly, what is the treatment? So lastly, what is the treatment of ranula? So surgery is the treatment of choice for ranula. What surgery will you perform for ranula? For ranula, I will perform marsupialization initially. So initially, I have to perform marsupialization. Marsupialization. Later, when the wall of the ranula is thickened, then wall is completely excised. So wall excision. So wall excision is done when the wall is thickened. So initially what is done? Initially marsupialization is done, then wall excision is done when the wall is thickened. And if ranula is small, it can be excised without marsupialization. And sometimes excision of sublingual gland is also needed. So sometimes excision of sublingual gland is also needed. Sublingual gland is also needed. And in case of plunging ranula, submandibular salivary glands needs to be excised. So in case of plunging ranula, submandibular gland is also excised. Excised in case of plunging ranula. So this is all about ranula and plunging ranula. Now I will show you one image about the management. So this is the management. See the image. See the image. In this image, you can see the management protocol about plunging ranula, that is marsupialization. In marsupialization, what is done? First of all, incision is given. First, incision is given through the oral mucosa. So, number one step is incision in the oral mucosa over the dome of the cyst. So, here you can see the surgeon is giving incision over oral mucosa, through the oral mucosa over dome of the cyst. Then, what is the second step? This is the second step. Then after giving incision in the oral mucosa, then incision made through the wall of the cyst. So in the first step, first in the oral mucosa incision is given, then incision is made through the wall. This is the wall of the cyst. Incision is made through the wall, and after clearing the content of the cyst, marsupialization is done. Marsupialization means this is the step 3. The wall of the cyst, see, the wall of the cyst is sutured to the adjacent mucosa to prevent further accumulation. So this is marsupialization. The wall is sutured to the adjacent mucosa to prevent further accumulation. So this is all about today's lesson, plunging ranula and ranula. For more such videos, don't forget to subscribe my channel, Dr. Shankar Dey. Thank you very much for your attention.